All right, today is August 8th, 2016. Hesperia School Police is at my door. What time is it?
It's like 9:30.
At 9:30.
I'll give you my card.
Officer Baker and Officer Gaskell are here to speak with me.
Sure. The reason we came out to your house is about an incident that occurred at Ranchero Middle School last week.
Yes.
Did you go in and meet with the nurse on a certain day, or can you tell me about what happened?
I'll tell you what happened. I received a phone call from the nurse or health tech a week prior to the school orientation.
Okay.
And the nurse was threatening that my daughter would not have access to public education if she did not receive her vaccinations.
Vaccinations, okay.
Now, I have 4 sons with neurological disabilities.
Okay.
House of Autism, I'm a caregiver.
Oh, okay.
Sorry, I've been doing yard work this morning.
No, absolutely. Take your time.
And so she was making threats, and I told her, well, my daughter's going to exercise her free right to public education.
Okay.
And document the violation, and anybody that stands in the way is going to be recorded, which is why I'm recording right now, just to, evidence is everything.
Absolutely.
The school district has not sent any kind of notice to my daughter of my daughter being denied her educational rights to public education.
Okay.
The district has not made any kind of action. They've put it on the hands of the school tech to do this.
Okay.
And so I told her, well, I'm going to go and, until I receive any kind of written notice saying that my daughter is not allowed to go to school, then I'm going to assume that she is able to do it.
Okay.
And that I will be documenting everything.
Sure.
And so the day of orientation, which would be the following week on, I believe it was Thursday.
Last week?
The 3rd,
okay.
I believe.
All right.
On Thursday the 3rd.
Uh-huh.
And we went to go get her schedule, and the group of the schedules for the children. My daughter's schedule was handpicked out of the pile from the other students, and the nurse had it in her possession, fully aware of everything.
Okay.
And there was a confrontation about the vaccination. She wouldn't give her the schedule, which is her educational records. The nurse had my daughter's educational records and was announcing my daughter's medical information publicly in front of all these other parents, which is a violation of my daughter's privacy. And she refused to comply, refused my daughter her education, told her she couldn't come to school today.
Well, by refusing, you just said she needed her vaccinations in order to be enrolled in the school. Is that my understanding?
She doesn't need vaccinations.
Oh, that's what she told you, though.
She said that well, first of all, Destiny doesn't need vaccinations because, we're preventing any further brain injury for the children.
Sure, I understand that.
We've had enough with the disabilities here at hand.
Okay.
It's a preventative measure.
Okay.
And she's the health tech, and she refused to provide her name in the earlier phone call.
Okay.
And whoever was advising her to do this, she refused to provide their name as well. So I'm not really getting any documentation here, other than my attempts as a parent to try to advocate for my child.
Okay. All right. Just so I understand, so you go in there, and they need proof that your daughter has vaccinations, right?
Yeah, in order to let her attend school.
To get the schedule.
Yeah.
To get her schedule.
And so I asked her during the phone call and in place, what are you going to do?
Okay.
You can't, my daughter, she has a right to attend school, but not only that, there's a mandate to attend school.
Okay. And what you said Thursday, what day did you have the telephone call with her?
That would be Friday.
The week previous?
Exactly, 1 week prior to the incident.
Okay. And did you tape record that conversation with her on the phone?
I don't have a recording of that.
You don't?
No.
Okay. So you didn't tell her that you were going to record the conversation or anything on the phone?
No.
Okay. Now, when you came in on Thursday, did you tape record that conversation with the nurse?
Yes, I did.
Okay.
And I advised her that I would.
Okay. So do you have the recording of you taping the nurse in the interview?
Yes.
Okay. So on the recording, it states that you told her you're going to record the conversation?
I already gave her advance prior notice.
Okay. Well, listen to my question. On the recording, does it say that, did you let her know that you were recording the conversation?
Not on the recording.
okay.
No, I did it on, when I began to go and get my daughter's schedule, to verify if she would get her schedule.
So that same day?
And, yeah, and it's public. It's public. It's a public school. It's a public agency. It's a public representative.
Well, these are some more questions that I'm gonna ask you, so don't kind of jump ahead. We gotta go right in order, okay? So did you meet with her in the nurse's office, in the lobby? I mean, where were you guys at?
It was in the lobby in front of, well, the nurse has her station in,
I'm
in the
familiar with
lobby.
Ranchero, so was it the nurse's office? Or
yes, it was the nurse's
okay.
office.
And were your kids there as well?
Yeah, my daughter was there, my son was there.
And your son is Carlos. What is your daughter's name?
Destiny.
Destiny, that's right. Okay,
Yes.
I've never met your daughter, but I think I've met your son.
She's a sweetheart. She's a
Is
good
she?
kid. She makes straight A's,
Wow, good for her.
you know. And she's very determined
Good,
to go to school and have her rights to attend public education.
okay.
And yeah, she's very vocal about vaccine injury and how she wants to protect her own health.
Okay, and she's going into 7th grade?
Yes.
Okay,
She has a personal belief exemption on file,
okay,
but when she transitioned from primary setting to secondary setting within the school district, that's not being acknowledged.
so she came from Juniper, and she's going to Ranchero now because she's in 7th grade.
Yeah, and she's enrolled as a student, and she will continue to remain enrolled.
And I don't know all the details, that's something you're gonna have to take up with the district, obviously, okay? My concern here today is the fact that you posted a video onto a social media site, okay? And I met with the nurse at Ranchero, her name is, I believe, Stephanie.
Stephanie,
Yeah.
okay, thank you.
And she said at no point in time did you give her permission to record the conversation. And apparently there's a video floating around. I haven't seen it yet. So that's why I just wanted to know if you told her you were recording the conversation or if you had it on video.
I had already told her, I had already put her on notice a week in advance.
So a week before.
And I told her at that orientation, now see, because I have special needs children, I have to attend IEPs.
Sure.
And when I do IEPs, I always notify the school in advance that I intend to record.
Okay,
It's been procedure all along.
okay.
I have to do that because I need to protect my kids' rights, especially if something's being violated.
And I don't want to get into the state laws about vaccinations, no vaccinations, because I don't know what they're doing, to be perfectly honest with you. The only thing that I've been asked to come out here and talk to you about is recording the confidential conversation that you had with the nurse.
It wasn't confidential. She did it in public.
Well, you're in her office.
It wasn't an office.
Okay,
It was a lobby.
Okay. So do you have a video on your phone?
Yeah, I have a video.
Can I look at it?
No, because I'm using it to record.
Oh, okay. You know where the nurse's office is at Ranchero, right? You know where her office is?
Yes.
Okay, so were you in that office?
It's a front desk in the lobby. I wouldn't call it an office. That would not be an appropriate term.
Okay. So when you walk into Ranchero, there's that front desk. Is that where you're telling me you spoke to her at?
Not the very front desk. It's right behind it in that lobby.
Okay, so you went inside through the doors, and was anybody else there besides you, the nurse, and the two
Oh,
kids?
yeah, there was a whole line of parents.
Okay,
Whole line of parents. Everybody got to hear it.
okay. So would you have any people's names or anything that were there that could confirm with me that you told the nurse that you were gonna record the conversation?
My children were with me when we were on the phone call.
Okay, well, your
And they can confirm that as well.
But your children would be kind of biased towards, you know what I mean, what your mom says. That's how I would look at it. So to help your situation, I would like to find an independent person that might have heard you tell the nurse.
Okay.
Unless you're telling me that you didn't tell the nurse that day, you were.
It's a public school. It was in a public environment, and she was the one that was delegated and assigned to represent in a public manner, putting my daughter's medical privacy out there in front of everybody.
Well, my understanding is the conversation took place in her office. That's why I came out to talk to you today about it.
Well, the problem is withholding an education from children. Education is important.
I agree, but that's something that I can't handle for you today. You know what I mean? That's you gotta go above me to handle that, and you gotta deal with the district. Okay? What I've been asked to come out here and talk to you about is the fact that you're recording the conversation without her knowledge.
Oh, she had knowledge.
And that's what I'm trying to get at. So give me a date and time that you told her you were gonna record the conversation.
Did she have anybody listening to the conversation?
Yeah, I don't wanna tell you what she said. I'm only curious to what you said.
Well, I mean, it's a two-way street. I mean, if
is.
you wanna get into this she said realm.
Right, but I talked to
Then-
her, I got her statement.
Yeah.
I want to talk to you.
Well,
and
I
get your statement.
put her on notice. I put her on notice and I advised her. And, you know,
On Thursday, when you went in that day.
nope, Friday. I gave her advance
The day
notice.
after?
Yeah,
Oh,
because
Friday
you
before.
have to give advance notice if you intend to record.
Okay,
And because she was not giving me any kind of information of any sort when we had that phone call, it was a 1 hour long, you know,
sure.
interrogatory type of scenario phone
Okay.
call. And she was being uncooperative, uninformative, you know, kept asking for directive, and I don't know who that other person is, you know, and she withheld critical information.
Okay, so when you went in on person was last Thursday?
Mm-hmm.
Okay, so the Friday before, last Thursday, you talked to her on the phone.
For a whole hour.
And I want to, what exactly did you tell her? Every future time we talk, I'm going to be recording, can I record this conversation? I mean, what is it that you told her?
I told her anybody that stands in my way, which she took it upon herself, stands in the way of my daughter's access to education,
Uh-huh,
that they will be recorded.
will be recorded, okay.
And I also said I'd protest in front of the school.
Like a picket sign or something, or?
Yeah, something, you know, I mean, denying a kid an education is not something to take quietly.
And that's well within your right.
Yeah.
Okay.
Yeah.
But don't you think it would be a better idea to maybe to go to the district office and talk to somebody if you're not getting anywhere with the nurse, you know, or meet with the principal?
Yeah, well, today's the first day of school, so it's the first official day
Yeah.
of where she said, you know, you don't have a class schedule, therefore you can't attend. So
Yeah.
it's a matter of formality at this
Sure.
point.
Is she-
Today, she's missed the day of school because she was told she couldn't go. So now I have to take it up on the district end of delegation
Okay,
for seeking how the district plans to accommodate.
okay. So she's not at Ranchero today, your
No,
daughter?
well,
She's here?
well, she was refused.
I don't know, okay, I'm just figuring
That's
this
on
out.
the video. The video says that she's being refused her education.
And I haven't seen the video yet, so
Yeah.
that's why I wanted to talk to you.
Okay,
and
well-
hopefully you can fill me in on this.
Hey, you know what? Here's the thing. If you violate a kid's rights, and maybe not maybe, and the state comes along and has a law that impedes upon a kid's rights, then, you know, it has to be declared and confirmed.
Right.
So my job as a parent is to confirm that this action has been done against my daughter.
And you're more than welcome to do that. Again, what I'm here today
Mm-hmm.
to discuss with you about is just the fact that you recorded the conversation
Mm-hmm.
unbeknownst to her, according to her.
Oh, she knew.
Okay?
She knew.
Okay.
She was repeatedly told during the phone call.
But what would make it a lot easier for me is if you had it on video where you said, just so you know, Miss Nurse, I'm recording this conversation before we talk about anything. Like you did with me when I walked up.
Well, you know, in
Yeah.
a public site, like for example, the park. Remember the camera guy that was taking pictures?
I do.
Yeah, and it got tossed, or there's an incident that untailed from that.
Okay.
You know, he's in a public place and has that right to do so.
Right. Absolutely.
Mm-hmm.
But the question here would be, according to her, you guys were in her office.
It's not her office.
And the kids were sitting down, you know, kind of in their same room with you guys.
You know,
I
if
don't-
she can't call that an office, I'm sorry, that's not an appropriate term.
Okay.
So that's misrepresenting in the first place.
Okay. So then for my report, you told her what on the phone call the prior week?
That I intend to record my daughter being denied her access to education.
And that's this conversation and all future conversations, just this conversation?
Oh, yeah,
Did you get specific?
You know, oh, yeah, I'm very specific.
Okay.
Anybody that is involved in my daughter not having access to her education is going to be recorded.
Okay.
You know, and I'm gonna document as things pan out.
Okay, all right. My phone keeps ringing.
Those days.
Huh?
It's one of those days.
Jeez. Okay. Can I just get your birth date?
September 10, 1978.
10, 1978. And that number I called for you, was that your cell phone or was it your house phone?
Cell phone.
So, okay. Do you have a different number that I also list on here to get a hold of you or just that one?
Cell phone.
Okay. Are you employed?
I'm a caregiver.
Caregiver. So that's kind of where we're at today. Apparently, again, I haven't seen the video, but there's a video that apparently you posted on some social media site, and it's kind of like a recording of your interaction with the nurse, okay? I haven't seen it yet, but they sent me out here to figure out what was going on, okay? Did you record it on your phone, or
Yes.
did you have another camera?
Yes.
Okay, were you like holding it in her face? I mean, did she see the phone in your hand? Oh, so you were holding it like that?
Point blank to your face directly,
Okay.
nearly selfie style. Okay.
Sure.
So
Did she ever say, are you recording me, or, you know?
no, she didn't
never said?
ask. She didn't ask. She was well prepared for this incident. Like I said, she got a hold of my daughter's class schedule, which is
Yeah.
gaining access to my daughter's educational records, which she had not my consent to.
Sure.
She's a nurse. She has access to medical records.
Yeah.
What she's doing with her fingers in my kids' educational records is beyond me, and I do not feel that's appropriate.
Okay. And again, I don't know what the district's policy is on nurses.
Well, the district, apparently allowed a nurse to take the initiative for this.
Yeah.
Maybe it's not her administrative duty. Where's the administrative portion?
Yeah.
It's
Well, and that's why I would, after you have the altercation with the nurse, I don't want to call it an altercation, but a disagreement, why wouldn't you get a hold of like a vice president or a vice principal or the principal and kind of get his take on it?
we're gonna get to that point.
Oh, okay.
I have things that I have to do in my schedule because
Okay.
I take care of disabled kids.
Sure.
And my time is spent, and I'm an exhausted parent. I'm tired.
Okay. All right. So for my report purposes, you told her the Friday prior that you're going to record every.
I was going to go to the orientation to retrieve my daughter's schedule because there's no notice saying that she cannot attend school. So I'm going to assume that she has the right to attend school. Then I'm going to go to the orientation, and I intend to record it.
So the day you were there was the orientation day?
Yeah,
Thursday?
it was orientation. It was a public event.
Gotcha.
It was a public event in a public area, not an office,
Yeah.
and
Okay.
and full of lots of witnesses.
Okay.
Nobody I know, just parents.
Just separate parents of students that go
Yeah,
there? Okay.
get and apparently everybody knows about my daughter's medical privacy now. So, I guess that's public too now.
So you couldn't tell me any other parents that might have overheard the conversation you were having with the nurse, or nobody comes to mind? Is anybody on the video, another parent or any other students?
Not to their face. Yeah.
Okay. I'm just trying to see if there's anybody else that I could talk to kind of, was everybody there for the same reason? Do you know? I mean, did you talk to other
Yeah,
parents? in the
everybody was there to retrieve their children's schedules.
Okay. So did you have a specific appointment, or did they say come in between 8 and 12 or something? I'm just.
Oh, no,
curious.
8 and 12 was
You just
the-
come in between 8 and 12 to get your students?
Yep.
Okay. All right, anything else, Officer Gaskell, ma'am? Do you have any more questions about what we're doing, or, okay?
No, I'm just really feeling sorry for my daughter.
No, absolutely.
She shouldn't have to be put in this situation. She is self-advocating,
Uh-huh.
and that's a good thing,
Sure.
but her dreams have been taken away. She can't go to orchestra, can't play in the marching band,
Right.
her dreams have been robbed from her. And
Well-
it's frustrating.
No, absolutely. I don't blame you. And you just have to make sure you're taking the proper steps in
And-
order to.
Yeah, and I'm taking care of disabilities all day.
Oh, absolutely.
And it's a task.
Sure, I'm sure it is.
Mm-hmm.
Absolutely. Anything else, Officer Gaskell, that you can think of?
I don't think you covered it all.
I'll give you my business card. If something comes up and you have any questions,
Mm-hmm.
feel free to call me, okay? And I'll give you the report number on the back. I'll go back and talk to the nurse and just kind of touch on a few things that you told me that she didn't, and we'll kind of go from there, okay? Uh, 16, what was it? 08. You had Carlos? He's your son also, right?
Correct.
Is he going to Cedar? Or Ranchero? Excuse me.
Ranchero. Yes, Carlos is going to Ranchero.
So he's there now?
Mm-hmm.
Okay. Okay. So here's my card. That's all my information. That's the address to the police department stuff. On the back, if you flip it over, that just has the report number, because we'll be doing a report.
Okay, Kevin Baker, can I have a copy of that report as well?
Yeah, you can, once it's done. I mean,
Are you gonna charge me $10?
that's up to the office. I don't know what their policy is on releasing reports.
Ah, come on. I've been to the police department before.
You have?
Well, for you guys, yeah.
Well, not for me, but
Well, the last procedure when my son, who I caregive for, got a head injury from the autism program at school.
okay.
And that report cost me $10. So I
Really?
didn't know if I was gonna be charged again for another one of my kids being violated. You know, I mean, let's,
And I don't know. I think they
Mr.
do
Gaskell,
charge.
is that correct?
Is
I
it?
think they do charge, yes.
Yeah. I don't know. I don't know what
And
they
they
do
charge,
up
from
front.
what I understand, they charge everybody. It doesn't matter who gets the report.
Okay, I'd like to put in a request that I get a free copy.
I'll talk to my boss, and I'll be in touch with you.
It's a gamble to ask, but hey, it doesn't hurt to ask,
No,
right?
absolutely.
That's true. They can't say no if you don't ask.
I'll talk to my boss, and we'll find out, what it is. It's just gonna take us a few weeks to obviously complete the report, and once it's done, I'll talk to my boss, and we'll kind of go from there. If you have any questions, the phone numbers and stuff are on there. You can get a hold of me or any one of my supervisors, okay?
Okay, and Mr. Gaskell, do you have a card?
I do. I apologize.
Are you the chief?
No. No.
Yeah,
That would be Chief Hinojosa.
I thought you were the chief.
No, ma'am.
Is he? Are you the chief?
Negative.
Not yet?
Don't want that job. There you go.
And then Sergeant Cook is the sergeant, okay? So
Okay.
him or Chief Hinojosa, they're the two supervisors.
Okay.
All right?
Yeah.
Nice to meet you. Good luck, okay?
It's gonna be a journey, but
It gets better. It'll get better. You have to believe that, because if you don't believe it, your kids won't.
well, if there's one thing that they're gonna learn, it's civil rights.
Right.
So,
That's kind of where we're at. And if anything else comes up, I can get a hold of you. I know where you live. I got your phone number. If
You
you have
have the
any,
right house.
yeah, I was knocking on your neighbor's house and I was wondering why they weren't answering. But yeah, if you need to get hold of me, you have the info, okay?
oh, well, thank you for your guys' cooperation and communication.
Absolutely.
You know, you guys are probably the most formal version of the district representing at this point. I don't want to say anything foul about the district, but I would like if they would step up to the plate and clarify, my daughter's rights in her education.
And we talked to my boss, and my boss is in contact with the district office on a daily basis, so I'm
Yeah.
sure they'll come up with something.
As the nurse said in the phone call, oh, you can go to the district webpage, and it'll tell you about the immunizations. And so, of course, I had my computer, and I'm like, oh, let me look, and I looked. And it was like a reference to the Huffington Post, and I said, well, that's not a formal statement from the district.
Well, are you familiar with the Senate bill that came out and all
I'm
that?
very familiar with SB 277.
Okay.
I've studied it
Sure.
religiously.
Good. You know more than I do.
No personal belief exemption religion pun. But I'm very familiar with that law and every aspects and details of it.
Good.
And it violates the rights of children.
Right.
So
Absolutely. And you understand the nurse didn't make that law.
I know she didn't make
Okay.
it, but at the same time, the district put her in charge to execute this.
Yeah.
And in a public manner at that. So it's turning into a mess, and I
Right.
hope it doesn't continue.
Right.
I would like to have a healthy relationship with the school district,
Sure.
even though I spend time in due process and 504 violations, but we try to maintain a civil, healthy relationship, even if there are disagreements.
Right.
But the thing is that in this particular scenario for my daughter, there's no formality. The district hasn't done their portion.
Okay. My recommendation to you is don't contact the nurse anymore. If you have any questions, get a hold of an administrator.
Oh, we're done with that end.
Yeah, exactly.
The only time I'm gonna have to be in contact with her is for my son, because he's disabled. She's probably gonna have to sit in an IEP for his care plan for his medical needs.
And that's Carlos?
Yeah,
Okay.
And so, or she can delegate it to Heather O'Brien. Is she the leads?
Yes. She works she's the head nurse.
Okay, well, technically I named her in a lawsuit, within the civil courts
Okay.
because of, she altered the date on a consent form for gaining access to my son's medical injury specific when he had a head injury down at
Okay.
Mesa Grande.
Uh-huh.
And so that was altered document, and so she was named in a lawsuit. I don't know if she'd want to sit in the IEP, but,
Yeah, we'll
you
figure it
know,
out.
I don't know what to say. I don't know what to say. I can advocate for my children. I can do everything I can, you know, but, you know, we'll just move forward, I guess.
And the last question I have is, on Friday before, when you talked to the nurse on the phone, you said you recorded that conversation also?
No, I did not
Oh,
record
you
that
did
phone
not?
call.
Okay, you didn't record it.
No.
So I'm just looking for something that you had on recording, that you advised the nurse that you were gonna record all the conversations and previous,
Well, who was with her?
I don't know,
You know, that she kept seeking directive. It was a 1-hour phone call,
yeah,
you know, and it's a phone call where you just repeat yourself.
over and
Are you
over.
denying my kid? You know, okay, well, we're gonna go. Is she allowed to go to this? Is she allowed to go to that? You know?
And just so I'm clear, that conversation on the phone wasn't recorded?
No.
Okay, but when you went in there in person the following Thursday, that is when you did record it?
Mm-hmm.
Okay. And
Which
then-
was in a public
got
event,
it, right.
in a public environment,
Somebody has the video, I just haven't reviewed it
and it
yet.
was also a violation of my child's civil rights.
Okay.
Yeah, we had you're talking about that state law that wants to inject your kids with toxins. Well, guess what? There's also a federal law, and it's called the Every Student Succeeds Act.
Right.
And that act was drafted to overtake the No Child Left Behind
Sure.
Act, because there were children with circumstances that didn't have equal rights inclusion, not just the disabled, but in general.
Right.
And so there's a federal law, you know, that provides, you know, billions of funding for the district to get their cut, but they're
Right.
not in compliance.
Okay.
So there's other issues at hand as well.
Right. And you-
Kids have rights, they truly
No,
do.
absolutely, they do.
And if they're being violated, you know, in a public manner, then that can be, you know, evidence.
Absolutely, but you have to understand that that's not what I'm here investigating. I don't work for the federal government.
I'm fully aware of what you're here investigating.
My
I'm
only
fully
con-
aware.
And it sounds like you're doing everything the right way, okay? I don't want to steer you in the wrong direction.
Yeah.
But just keep in mind that it is a violation of state law
Mm-hmm.
if you're recording any type of conversation without divulging that you're doing so, not in a public place. Okay?
She was put on notice, and she had it right to her face.
Okay.
So,
So when I review the video, I'm gonna see you with the, well, I'm not gonna
do
see
you
you.
have a
'cause you're
camera? Do
recording.
you have a camera in the office?
Yeah, at Ranchero. We'll look at that.
Yeah.
I haven't got that far
Yeah.
yet, but we'll double check on all that. And you were using that phone?
Correct.
Okay. All right. And there's no way that I can look at it right now because you're recording us.
Yeah, that would.
Okay. All right. I just want to make sure I understood everything. Okay, any other questions?
No.
Okay, I'm gonna go talk to the nurse at Ranchero, and if anything else comes up that you need to know, I'll give you a call or I'll stop by. I don't wanna keep bothering you, I know you're busy, but I'll keep you in the loop and let you know what's going on, okay? Perfect?
Yeah.
All right, thank you.
Have a good day.
End of recording. August 8th, 2016, with Officer Stephen Gaskell and Kevin Baker in regards to recording Destiny's video about being denied her education. Time stop, 10:11, 29 minutes of recording.